Hi everyone, today I'm going to discuss about the topic Phlebitis Assessment. I'm Julian K. Thomas, faculty working in Tripoli College of Nursing. The objectives of this discussion include the group should be able to define phlebitis, enlist the causes of phlebitis, list down the signs and symptoms of phlebitis, brief the assessment of phlebitis, describe the preventive measures of phlebitis, enumerate the management of phlebitis and mention the complications of phlebitis. Phlebitis. What is a phlebitis? Phlebitis means inflammation of a vein. So this is a complication of peripheral intravenous therapy which is usually associated with acidic or alkaline solutions or solutions which have an high osmolarity. So when we administer solutions like acidic or alkaline, or if we are administering solutions which has a high osmolarity, so this inflammation of the vein can happen. So phlebitis can also occur as a result of vein trauma where during the insertion or use of an inappropriate IV catheter size of the vein or prolonged use of the same IV site. So this phlebitis can occur in both the surface such as superficial and deep veins. Thrombophlebitis. What is a thrombophlebitis? Thrombophlebitis is the formation of a thrombus in the vein and which can causes inflammation in the vein, or a blood clot in the vein which causes the inflammation. So thrombophlebitis usually it occurs in the leg veins, but it can occur in the arm also. So this thrombus or the clot which is present in the vein which can causes pain and irritation of the vein. So that may block the blood flow in the vein. So that can leads to inflammation of the vein. Superficial phlebitis. Superficial phlebitis affects veins on the skin surface or surface of the skin. So it is rarely serious with proper care and management usually resolves rapidly. But in some people, if we left untreated, the superficial phlebitis also get deep vein thrombophlebitis. So a medical evaluation is necessary. So as early as possible, we have to treat the superficial phlebitis to avoid complications. The superficial phlebitis is usually of a slow onset of a tender red area along the superficial veins on the skin. A long thin red area may be seen as the inflammation which follows the path of a superficial vein. So this area, if we palpate and see, we can feel it's like a hard, warm and tender area. The skin around the vein may be itchy and swollen. The area may begin to throb or burn. So also the patient will be manifested with a low-grade fever. Deep vein thrombophlebitis. Deep vein thrombophlebitis is a serious condition in which this affect the larger blood vessels deep in the lungs. So what is the complications behind this deep vein thrombophlebitis is that the blood clot which is present in the deep veins which can get detached or break off and can travel to the lungs. So this is a potentially life-threatening condition called pulmonary embolism. So this thrombus or the clot will move along the blood vessels and it will reach the lung and it will cause obstructions in the pulmonary circulation. So the patient will be manifested with breathing difficulty. So this is a potentially life-threatening conditions. The other two terms which is associated with this phlebitis is infiltrations and extravasations. So what is infiltration? So IV infiltration occur when fluid leak out of the vein into the surrounding soft tissues. So the common signs of this infiltrations include inflammation, tightness of the skin and pain around the IV site. So IV infiltration, it is a common complications of the intravenous or IV therapy. So when the IV therapy is done, so this can be caused by the improper placement or dislodgement of the catheter. So thereby the fluid which is given to the patients will be leak out from the vein into the surrounding soft tissues. So the patient movement can cause the catheter to slip out or through the blood vessel lumen so that the fluids leaks into the surrounding tissues. So that is infiltration. The other one is extravasation. So extravasation is the leaking of vesicant drugs in the surrounding tissue. So when we are administering certain drugs through the IV, so it leak into the surrounding tissue. So that is known as extravasation. So extravasations can cause severe local tissue damage, possibly leading to delayed healing, infection, sometimes tissue necrosis, disfigurement, loss of function, and even amputation. Risk groups. Who all are the risks for developing this phlebitis? Patients, those who are having varicose vein, who has the history of smoking, overweight, usage of contraceptive pills, or hormone replacement therapy. So this slightly increases the risk of developing blood clots in the blood vessels. So this blood clots can cause inflammation of the vein and leads to phlebitis. And in pregnancy, history of any previous blood clot or any other problem with the vein. Recently, the patient had any injections or drip put into the vein. History of conditions that can causes the blood to clot more easily, such as a thrombophilia or inflammation of the smaller arteries, that is polyarteritis, or a high concentration of red blood cells in the blood, or polycythemia. The other risk include cancer. So these are some of the risk factors which can increases the chance of phlebitis. Phlebitis causes. So, what are some of the reasons or causes for getting phlebitis? IV catheterizations or IV therapy, or patients with varicose vein, a prior history of phlebitis, irregularities in the clotting factors. Patient is more prone to develop clotting disorders. And the mechanical cause include due to large catheter for the size of the vein. If we are selecting an inappropriate catheter for IV cannulation, or manipulation of the catheter, improper stabilization. So after entering into the vein, sometimes we'll slightly change the position of the catheter to make it into the correct position. So manipulation of this type of catheter can lead inflammation. And the chemical causes include vein become inflamed by irritating or vesicant solutions or the medication. So some solutions, alkaline or the acidic, or the solutions with a high osmolarity, so high content in the cells, so that can also leads to inflammation, or irritation caused by medications or solutions, improperly mixed or diluted solutions, or very rapid infusions, presence of particulate matters. The more acidic the IV solutions, the greater risk for developing phlebitis. Then length of indwelling catheter, 30% by day 2, 39 to 40% by day 3. So each hospitals have their own policy of changing the IV cannulas on time. So based on the hospital policy, so we need to change the IV cannulation. So mostly by within 3 days, we should change the IV cannula. The other reason or causes of phlebitis include bacteria. So that is known as the bacterial phlebitis. It is also called septic phlebitis, which is least common because as we are ensuring that on a sterile technique we are inserting, this bacterial phlebitis is least common. So inflammation of the intima of the vein, the contributing factors for this bacterial phlebitis is poor aseptic technique, failure to detect breaks in the integrity of the equipment, poor insertion technique, inadequate stabilization, failure to perform the site assessment, aseptic preparation of solutions, hand washing and preparing the skin. So if we are inserting an IV cannula or IV cannulation in an aseptic technique, there is a chance for infections in the intima of the vein. So that is known as the bacterial phlebitis. The other cause include that is known as the post-infusion phlebitis. So once the IV catheter has been removed, inflammation of the vein can happen within 48 to 98 6 hours after the discontinuation of this IV cannula. So that is known as post-infusion phlebitis. So the factors which contribute to the post-infusion phlebitis are improper insertion technique, condition of the vein use, the type, the compatibility and the pH of the solution which we have given through that cannula, gauge, the size, the length and the material which is used, the dwell time, that is how long the catheter was there in that place, infrequent dressing change. Host factor include age, gender, age and the presence of disease or any other infections in the patient. Phlebitis pathophysiology. How this phlebitis happens? So when there is a clot or a thrombus, or when there is an irritation of the vein, there will be inflammation of the vein in which the endothelial cells of the vein become irritated and the cells will become roughened, which allow the platelet to aggregate or to adhere to the blood vessels and predispose the vein to inflammation. So that is known as induced phlebitis. So that area of the patient will be very hard, tender to touch and will be very painful. Phlebitis signs and symptoms. So what are the common signs and symptoms associated with phlebitis? So there will be redness at the site. The site will be warm to touch. There will be local swelling will be there. Palpable cord along with the vein. When we palpate the site, we can feel a hard area, palpable cord along with the vein. Sluggish infusion rate. So the fluid which we are administering through the site will go very slow. Increase in the basal body temperature of 1 degree Celsius or more. So we have different methods to assess this phlebitis. We have different scales for assessing this phlebitis. So one among that is the INS phlebitis scale, that is Infusion Nurses Society phlebitis scale. So they have categorized based on the score. It grades from 0 to 4 based on the symptoms or signs and symptoms the patient shows. So which includes the scale starting from 0 to 4 and based on the clinical criteria. So 0 indicates there is no symptoms. 1 indicates there is erythema at the access site with the patient will have pain with or without pain. So erythema at the access site with or without pain is 1. 2 is the patient will have pain at the access site or the IV insertion site with erythema or sometimes swelling or edema will be there for the patient. That is grade 2. So grade 2 indicates pain at access site with erythema or edema. Grade 3 indicates the patient will have pain at the access sites with erythema or edema. And the second one is the streak formation. So we can palpate the vein, that is a palpable venous cord. So if these three will be there, we can grade it as the 3. So pain at the access site with erythema or edema, streak formation, and if the patient is having a palpable venous cord, that is grade 3. And grade 4 where the patient will have pain at the access site with erythema or edema, streak formation will be there, palpable venous cord more than 1 inch in length, and there will be purulent drainage through the IV site. So which indicates that the patient is having severe infection. So this is the grading, that is from 0 to 4, which is given by the Infusion Nurses Society. The other scale which is used to assess the phlebitis is the Visual Infusion Phlebitis Scale, or otherwise it is known as the VIP score. So Visual Infusion Phlebitis Scale, which is graded from 0 to 5. So on the left side we can see what is the signs and symptoms the patient shows, and the right side they have explained about what is the nurse's responsibility in each stage. So the grading starting from 0 to 5, 0 which indicates the IV site appears healthy. There is no signs of phlebitis. So that is, there is no signs of phlebitis. The nurse's responsibility is to keep on observing the cannula site. Grade 1 which it shows the signs and symptoms include one of the following is evident. That is slight pain near the IV site or slight redness near the IV site. Any one sign is present which indicate the patient is having grade 1. So this is a possible first sign of phlebitis, and the nurse's responsibility is to observe the cannula. And in grade 2, the signs and symptoms include two of the following are evident. That is pale near the IV site, erythema or swelling. So any two in this three is present for the patient, which indicates grade 2. So this is the early stage of phlebitis where the nurse need to resite the cannula. And in grade 3, all of the following are evident. That is pain along the path of cannula, erythema, and the induration will be there for the patient. So this is a medium stage of phlebitis where the nurse need to resite the cannula, and also she need to consider treatment, whether treatment should be provided for the patient, so need to discuss with the physician. And grade 4, all of the following are evident and extensive. That there will be pain along the path of cannula, erythema will be there, induration will be there, palpable venous cord will be there. So this is the advanced stage of phlebitis or starting of thrombophlebitis, where the nurse need to resite the cannula and also to think about treatment or consider treatment. And in grade 5, all of the following are evident and extensive. So there will be pain along the path of the cannula, erythema will be there, induration will be there, palpable venous cord will be there. Along with that, the patient will have high grade fever, that is pyrexia. So which indicates there is severe infection. So all of the following, this 5 is evident and extensive, then we can say it is grade 5. So here this is an advanced stage of thrombophlebitis. So we need to initiate treatment or start on with the treatment and need to resite the cannula. So this visual infusion phlebitis scale, so with the diagram, so score 0 which indicates the IV site appears healthy. So there is no signs and symptoms of phlebitis. VIP score, score 1 One of the following sign is evident. That's either the patient will have slight pain, pain score will be 1 to 3 near the IV site, or slight redness near the IV site. So here the patient may not require any analgesics. VIP score grade 2 or score 2, two of the following signs are evident. In this three, any two will be evident. That is pain at the IV site, pain score will be 4 to 6, there will be redness near the IV site, or the patient will have swelling. So it will interfere with the activities. Patient is unable to do the activities. And in grade 3, all of the following signs are evident. So pain along the path of cannula, moderate pain will be there. Pain score will show 4 to 6. Redness around the site, swelling and warmth. So it interferes with the concentration. So which indicates that the patient is having moderate pain. Score 4, all of the following signs are evident and extensive. Patient will have pain along the path of cannula, that is severe pain. Pain score will be 7 to 9. Redness around IV site, swelling, palpable venous cord. So which will interfere with the basic needs of the patient. Patient is unable to do the activities of daily living. Score 5, all of the following signs are evident and extensive. There will be pain along the path of the cannula. The patient will have the worst pain possible. The pain score will be 10. And there will be redness around the IV site. Swelling, palpable venous cord will be there. And the patient will have high grade fever. That is pyrexia will be there. In this case, the patient required bed rest. Prevention of phlebitis. So how we can prevent this phlebitis? So you always follow universal infection control measures. Hand washing before and after procedure. Patient skin preparation should be done carefully. Wearing gloves and aprons during the procedure. Establishing a clean environmental field. Using sterile equipment. Disposing of contaminated or soiled equipment and linen appropriately. And the safe disposal of the shaft. So by these measures we can prevent phlebitis for the patient. The other measures of preventions include use proper venipuncture technique, use a trusted drug reference or consult with the pharmacist for instructions on drug dilution. So drugs with high osmolarity, acidic or alkali. So we should get information from the people and then we have to administer. So monitor administration rates and inspect the IV site frequently. Assessment of IV site and patency of IV cannula. Place the limb on a firm surface. Assess IV site of the patient for any redness, edema, tenderness or leakage frequently. So always take 10 ml syringe filled with 1 ml distilled water, attach it with IV cannula and pull back gently on the syringe plunger to aspirate blood to assess the patency of the IV cannula. So keep on, we should assess the patency of the IV cannula. So if blood returns, which means the cannula is patent. So irrigate the IV cannula with distilled water. And when we are administering, there is no resistance, which indicates the cannula is patent. So these are the two methods where we can assess the patency of the cannula. Use larger veins for hypertonic solution, that is high osmolarity solutions, and central lines for infusion lasting longer than 5 days. So if any medications or fluids which we need to administer more than 5 days, we need to select the central line. Management of phlebitis. So how we can manage phlebitis? So if we identify any redness or pain at the IV cannulation sites or the 0 grade or the first grade itself, we need to stop the infusion at the first sign of redness or pain. Monitor patient vital signs and the IV site. Grade the phlebitis using the grading scale, either INS scale or using the VIP scale. Apply warm moist compress over the area. Continuous application of moist heat over 72 hours. Administration of oral non-steroidal anti-inflammatory drugs and apply thrombophore over the area. So document the patient's conditions and interventions. If indicated, we need to insert a new catheter at a different site, preferably on the opposite arm using a larger vein or a smaller device, and we need to restart the infusion. So we don't keep the same site or don't continue the infusion and continue monitoring the signs since the symptom resolves. Coming to the nurse's responsibilities, the first and the foremost one is the hand hygiene. So hand hygiene should be performed before and after the procedure. So hands are decontaminated immediately before and after each episode of patient's contact with the correct hand hygiene techniques. That is the 5 moments of hand hygiene should be followed. Then observe aseptic technique. So always wipe the site, clean the site, and then we need to cannulate the patient. Then patency, always we need to check. Patency should be maintained. Third one is monitoring. So keep on monitoring the intravenous therapy or the IV site. Check the infusion and the IV cannulation site at least every 4 hours. So each shift we need to check the IV site using the VIP score. Then we need to check off the flow of fluid, the IV site, any erythema, wetness, edema or redness presence, phlebitis and infiltration. Assess for any chills, fever, headache, nauseated feeling, vomiting or anxiousness and dyspnea. So cannula should be removed where it is no longer indicated. So simply we should not have an IV cannula for the patient. And the fourth management is the dressing. A sterile, semi-permeable, transparent dressing is used which allow the observation of insertion site made accessible. So ensure that the IV line is anchored and secured properly. So also this dressing is also based on the hospital policy. Fifth point is the cannula replacement. So reset cannula after 72 hours or as clinically indicated. For such like example, the blood transfusion when we are doing, we should use a large size cannula that is 18 gauge. Document each time after the change of IV site. So this cannula replacement also based on the hospital policy. Then document in thrombophlebitis observation chart and in the patient case note with the date and time, the insertion of the cannula and when they have removed the cannula, what was the dwelling time of the cannula with the signature of the nurse. The complications of this phlebitis include the patient may develop with cellulitis or there will be thrombophlebitis, deep vein thrombosis. So this deep vein thrombosis can detach and it can go as a moving clot and cause pulmonary embolism. So these are some of the major complications of phlebitis. So to conclude, phlebitis is an important ongoing problem in present day clinical practice. Avoiding of preventable risk factors, proper nursing care and daily inspection of the catheters needed for prevention of phlebitis. So it is the responsibility of the staff nurse to assess the IV site of the patient carefully and identify the changes at the earliest to prevent complication. So the access site should be observed at least 48 hours after the catheter removal to ensure appropriate management if post-infusion phlebitis is identified. Proper documentation is necessary to avoid errors. Thank you.